I'm Amy Bales, and a pediatric physical therapist at Cincinnati Children's Hospital and assistant professor at the University of Cincinnati College of Allied Health Sciences. I'm delighted to be speaking to you today on behalf of my co-authors and the caregivers that participated in this survey. Our paper, Caregiver Knowledge and Preferences for Gross Motor Function Information in Cerebral Palsy, appears in the December 2018 issue of Developmental Medicine and Child Neurology. It is a cross-sectional study that was carried out via an online, anonymous, self-administered, structured questionnaire to determine caregivers' knowledge and preferences for gross motor development information in CP. What's already known about this topic is that parents say motor development is a primary concern for them and that they would like information about this, but feel therapists are reluctant to discuss this topic. We also know that the Gross Motor Function Classification System, or GMFCS, was developed in 1997 and designed to be used by clinicians to help families understand a child's current abilities and to discuss what their abilities are likely to be in the future when used in conjunction with the motor curves. There have been numerous publications that show that GMFCS is being utilized successfully by researchers. However, the GMFCS does not appear to be utilized as frequently in clinical practice or in family-centered care. What's new in our article is that we heard from 303 caregivers of children with CP with varying GMFCS levels and ages about their knowledge and preferences for gross motor information. 137, or 45%, of the caregivers that responded knew their child's GMFCS level at the time of survey. 94, or 31%, of caregivers knew how their child's motor skills compared to other children with CP, while 224, or 74%, of the respondents would like to know how their child's function compares to other children with CP. Further, the most frequently selected person the caregivers reported they would like to discuss motor information with was the therapist, followed by the doctor. Only the level of education of the caregiver was significantly associated with their knowledge of the GMFCS level, with higher levels of education being associated with caregivers knowing the level of their child. Race and level of GMFCS of the child was not associated with their knowledge. Of the 137 caregivers who knew their child's GMFCS level at the time of survey, 83% of them thought it would be helpful to revisit this topic over time. Caregivers of children in GMFCS 1 to 3 preferred to learn at the same time as receiving the CP diagnosis and were more likely to report having received visual aids. Caregivers of children in levels 4 and 5 found it more difficult to learn their child's level and reported seeing pictures with descriptions more informative. In summary, not enough parents are provided with GMFCS information, despite the large number that think it would be helpful, and even fewer know about the motor curves. We hope that you will read the full article in this December's issue of Developmental Medicine and Child Neurology and think about ways you and your team can improve your information sharing techniques to meet the needs of caregivers and their families. Thank you for listening.